this evening we're so privileged to have a panel of patients that are going to speak to you a little bit about their experience and hopefully answer some questions for you. I think it's so important to hear and learn from other patients who have gone through treatment and diagnosis and be able to share their stories. And what I'll do is I'll ask them to talk a little bit about their experience and their diagnosis, maybe 5 minutes or so, if we can get a summary, and just tell you a little bit about what they went through. And then we'll open it up for questions from all of you. So I'd like to introduce Jessica, Jason, Nicole, and Richard. I'll forget everybody's names, so apologize in advance. But representing a variety of different diagnoses with melanoma and some of the different challenges that you went through. So maybe we'll start with you, Jessica. You're just close to me. Sure. You get the short straw.
Hi, can everyone hear me okay? Yeah. My name's Jessica. I was diagnosed almost exactly 3 years ago, right after having my daughter. I discovered a mole on my bum, lower back area. So I discovered a mole that had changed during my pregnancy. And I'm a freckly, moly person, so, you know, it's hard to keep track of them sometimes. But this one definitely looked different. And my GP had said, oh, don't worry about it, get it checked out after delivery. My OB said the same thing. So it was about, our daughter Naomi, she's 3.5, but she was 5 months at the time. And a dermatologist downtown removed it right on the spot. And he said, you know, I'm really concerned, and we're going to take that off right now. And then within about 2 weeks, I was meeting with Dr. Wright and Dr. Petrella, and I had a wide excision, sentinel node biopsy, and the likelihood of it being in my lymph nodes was, I think, 4%, and it was. So I was diagnosed stage 3. And at that point, 3A, and at that point I had the choice to watch and wait through ultrasound monitoring or do interferon. And I don't think anyone really wanted me to do interferon, but I had a 5-month-old at the time, and I thought, you know, I had to do something. I just wasn't comfortable with doing nothing. So I said, you know what, if it gets bad, I'll stop and we'll just give it a go. And it was really bad. Interferon was really bad for me. I had a bad experience. A lot of mental health issues, depression, very bad anxiety, significant weight loss. I lost a good part of my hair, like just thinning. But it was mostly probably the mood, the anxiety, and the depression that was hit the worst. The good news is I have been, I guess, no evidence of disease since then. So all of my CTs have been clear, and I'm waiting, I guess, just on one more, which will be Monday, and then that will be 3 years. And I haven't done any other treatment besides that interferon. I stopped after 10 months, and that's where I'm at today. So I've been followed by ultrasound monitoring of the lymph nodes in my groin, and then CT scans.
Oh, thank you. You're free of disease. Thank you.
Hi, can everyone hear me? So my name is Jason Smith. I'm 47 years old, investment banker by day, father of 2 by night, and I was originally diagnosed with exactly what you said, right? You stole my thunder. A funny looking mole that started to change. I went to my GP and he said, don't worry about it. 6 months later, went back and he said, well, we'll take it off, but it doesn't look that bad. So he sent me to a dermatologist who took a little snip of it, and she wasn't concerned either, but then the test results came back and here we are with melanoma. So at that point, I was stage 2. They did the lymph node checks and everything was clear. So that was good. I decided not to do interferon, just hoping, let's roll the bones and hope this doesn't come back. About 3 years later, it did come back in my lung. So I had part of my lung removed, ended up on a clinical trial for ipilimumab, and that went fine. And then 3 years ago, it came back again in my other lung, And so since then I've been on Pembro, and it's going very well. The tumors are almost gone. I've had no ill effects. I go to work every day. I play with my kids at night. I feel totally fine. So it's been a bit of a miracle for me.
Wow, that's awesome.
Hi, my name's Nicole, and pretty much exactly the same as them. I started with a mole on my calf, my right calf. Went to my GP. She sent me to what I thought was a dermatologist, and at first she said it was fine, and she just kind of tried to burn it off, and then I kind of left it for a few months, and about 6 months later I went back because it had changed, and she cut it off, and sure enough I had melanoma. Had one lymph node removed, and it had spread to there, so had them all removed. I did do the year of interferon. The first month was definitely the worst, but after that it was okay, somewhat. Made it through the year. I just finished this May, and so far I've been clear, and fingers crossed that it doesn't come back.
Wow, awesome.
Well, I think, is this on? Can you hear me?
Yes.
Oh, there
Yep,
we are.
it's working.
Okay, now I feel like I'm in a gallery of youngsters here because I was diagnosed at 62. I had had a rather stressful couple of years in business and walked away for a few months, thank God. Came back to Toronto and thought, okay, I have to deal with this stuff. And I went to my doctor for a regular checkup because I was pretty low. And he knew instantly there was a spot on my back, just a skin tag in my lower back. And I couldn't see it, so I didn't know it was there. I could feel it. And he sent me to the dermatologist. Fortunately, I was downtown, and my doctor was well connected. I went into the dermatologist the next day, and he knew exactly what it was. He said, this is bad. Either I take it off now, or you're in Princess Margaret next week. And they took it off, and I was stage 3 at that point, stage 3A. I did a lot of research. I was terrified by it. I think everybody that goes through this, there is nothing, I always thought I was invincible. You know, with this, there's no invincible. And I was introduced to Dr. Hogue, and he was wonderful, absolutely marvelous guy. And the course, I think the standard for treatment they spoke of at that time was to do sentinel node dissection. And if there was anything showed up, go downstream. So I had the right axilla, and of course, they found cancer there, or it was positive. And I researched and spoke to both the oncologist, I guess, and the surgeon. And it took me a long time to make a decision. I actually waited a couple of months because I didn't want to do anything. My instinct was to lay low and see what would happen. Either that or it was the fear. I'm not sure which. But in the end of the day, I elected not to do interferon. And I spoke to a few people who had done it, and remember that I was 62 years at the time, and I knew what the efficacy was, or I thought I knew, and I did the math. And for me, it wasn't worth it, not to lose a year and a half of sickness out of my life, which is what I anticipated. And remember, this probably dosing at that time may have been stronger, I don't know. But I met people, a couple of guys that had had it, which was really important to me, and I wasn't about to put myself through that. Now, it isn't that I did nothing, and I think this is where my conversation goes off the rails a little bit, because my deal with the devil was to research it. I had been fortunate enough to have had contact with a woman who was then the executive director of Gilda's, and that was totally an accident. And I got into group therapy there. And it was the best thing I had ever done. I had to be sucked into it. Most guys won't do group therapy. I did. I was shamed into it. And I learned so much from the other people who had it. There's a lot of fear that comes to what about the medical system, what about the chemical system, et cetera. Getting it from the other people, not necessarily melanoma, but cancer patients, you get a lot of information. And a number of those people were, as I was, researching naturopathic. I ended up going to the cancer shift at the student clinic, at the Robert Shedd Clinic, naturopathic. And I made a decision to go there every week for a year to learn what I should have been doing for the rest of the earlier part of my life. And I learned how to de-stress between there and Gilda's and Wellspring. I walked away from all the stressors in my life, which meant walking away from my business and a difficult relationship. And I focused on my physical health, on nutrition, juicing to this day. And it isn't that I did nothing, I did a lot. But to some people, they don't understand. I remember a woman in the States saying to me, I don't know how kale can make you well. And I thought, you got a long ways to go, you know, because your immune system needs to be strong. And for me, if I could make my immune system strong my way or by doing healthy things, I chose that. I have been with no evidence of disease since. Dr. Hoga's fabulous. Anytime I have anything that changes in my body, he's there like that. So we have a tremendous system here. But we also have choice. And at the end of the day, he said to me, you made the right decision. Well, it was for me. So if there's any way I can help anybody at any point with this, it's an amazing journey and a difficult journey. And I think the hardest part for me was that of the, I think, 15 people that were in my group at Gilda's, there were 3 of us left. And every one of those, each of those 3, really focused on immune system health and their health. That's the best I can share with you. Thank you.
We'll open it up to questions if anyone has any questions of the panel members. So.
Part of being at the Naturopathic College, and I guess the analysis of your blood was important, and your blood type and so on. And they essentially counseled me on the nutrition that my body needed through, I suppose, blood among other things. And to this day, I take a significant amount of supplements. I take nothing chemical. It's all natural. I focused on organic where I could, and learned about that, because there's a lot of learning. There's a lot of false information about organic out there too. But I juice every day. I followed the Gerson thing to some degree. But the learning really came from the Naturopathic College and their counsel, which I think is powerful for anybody. I juice raw every day. I'll go through at least 2 pounds of carrots, etc. So I do my dogs, and then I do me, and they get the, the leftovers.
Just wanted to ask each of the panel members, we've already mentioned, and I think you've all been very honest and such, this is no easy ride, right? This is, you know, it really takes you by storm and changes the path and the trajectory, I think, of your life. And that, how we respond to crisis is often, you know, learned.
10 years later, 10 years later, I have a little problem, and I'm not swallowing right. I think whatever, it's 10 years. Oh, well, excuse me, 2010. I'm a little off, not far off. I called the oncologist, and the amazing thing with that, within an hour, I'm into TGH, getting a scan, and it's terrifying. 8 years later.
Yeah. So we've heard a little bit from Richard and such. I'd be interested as well to hear from some of the others. You know, it can leave us with a lot of despair, anxiety, or that, you know, oftentimes, even though there's tons of people around, you can have a feeling sometimes that you're alone, and you're alone in the battle for sure. But, you know, even though you have a lot of people around, it can leave you, you know, really in a state. Any suggestions or anything that you learned in your journey and how you've been able to cope, or what made you feel better along the route? Wine is the suggestion here. I'm fully supportive of that in reasonable amounts. Okay, yep, I'm with you on that one. Any thoughts, Nicole? Or sorry, go ahead, Richard.
One of the things that I remember being said to me by a young student who was like in her 8th year at the Naturopathic College, most beautiful girl I've ever seen, and disgustingly young and disgustingly clean looking. You know, these kids are so smart. But she said to me, she said, you know, sometimes you'll come in and we have an hour there, not 5 minutes. is a difference. And I remember her saying to me, she said, you know, sometimes you just need to talk. And I think guys are really bad at this. But the talking and sharing with somebody on the journey is so powerful, because you can really get rid of a lot of the fear and the anxiety. And the anxiety drives your immune system into the toilet. So you've got to get that out. And so it's the social factor that was what Gilders was focused on originally that was all important.
Okay. Nicole, any thoughts from you? What helped you get through 10 months of or a full year of interferon?
Yeah, I think the support definitely, even whether it's a melanoma patient, any cancer patient, I think is a good person to talk to. You might be going through a different journey, but at the same time, you're going through the same journey. And just having a good support system around you, good friends, family, that's what got me through it, was having my friends with me, for sure.
Not being scared to ask for help.
Oh, yeah, for sure. You have to ask for help, 100%.
Yeah, a lot of times they don't know what to say or what to do, and
yeah.
they, people say things during the journey that kind of make you crazy after a while, but it's not until you're in the situation. Sometimes it's hard to really know what to say, from a family or friend perspective. But I think sometimes patients can help by asking for what they need.
100%. Yeah. And also kind of doing it with a smile, even though it's hard.
Yeah, exactly.
But yeah, that's what helped me anyways.
And Jason, besides wine, were there anything else that really helped?
So I think for me, it was interesting. The first couple of years, I really felt like I went through it by myself. I had a doctor to talk to, and I could talk to my wife, but we have 2 little kids at home, and they were really time-consuming, as you know. My dad was diagnosed with colon cancer about 2 years after I was diagnosed with melanoma, and so he talked to me about it, and then I started talking to him and realized, wow, I haven't really talked to anybody about this. So that was, I don't want to say, hey, my dad getting cancer was really good for me, but it was good to have someone to talk to, and I think he felt the same way, that you kind of do need to have someone to talk to who understands it. Like you were saying, that you were talking to these people who are going through it, right? It's, it's nice to have a spouse to talk to, but the spouse isn't really going through it. They're going through it vicariously, right?
Mm-hmm. Mm-hmm.
I think, and I actually mentioned this to Annette when I came in the door, for me, the anxiety and the mood changes and the stress that you feel down the road is very different from the stress you feel when you're first diagnosed. And I think it's important to understand you might need different support at different times. So in the beginning, I found, we were really seeking information and trying to suck everything up, and the support groups were amazing. Annette was amazing. And then friends and family, of course. But then down the road, you're years in and you feel like not everyone in your life kind of forgets what's happening, but then you become that you're just, your little family unit, or only your close friends might know that you're still fighting this and dealing with it. And so I find now at this point, it gets harder around the times of tests or scans or appointments, and that anxiety and that, the mood changes can kind of creep up in ways that are different than how they first expressed themselves, and it manifests in a different way. So now, we try and, I know that before my scans and before my appointments, I'm going to be irritable, I'm going to not sleep well, I'm going to, be anxious. And so we just try and kind of keep life pretty boring for that, 3 weeks, 2 weeks or so. Because at first I thought, stay distracted. But now it's kind of just go about it, a really good routine, find what's good. Like for me, it's exercise and social and family time, and keeping things very stable and like comfortable for yourself when you're going through those stressful times, not putting extra pressure.
Yeah, so I've gone through immunotherapy, both ipilimumab, and when I went through that, there was no sign of cancer in my body, and I went through it for about a year. With no side effects, still no sign of cancer. So the doctor and I kind of mutually agreed to cancel and stop, because there's always the risk that you could develop a side effect later on. So what I'm on now is
Pembrolizumab.
thank you.
Keytruda.
And the results have been fabulous. You know, I have 0 side effects other than, so I get an infusion every 3 weeks. I'm a little tired for a couple of days afterwards, but it's not bad. I'm a little tired. Everybody's a little tired from time to time. I run. I've always been a runner. I ran a 100K ultra marathon.
Wow.
3 months ago, in the middle of this treatment.
I think the interesting thing about these new therapies and such is it's such a powerful thing to see people not only surviving but thriving. You know, traditionally when you heard, you know, chemotherapy and you knew people were going to lose all their hair and, you know, they're going to be sick and it's going to be nasty for a period of time, and it's a completely different type of drug therapy. It's not going to work for everybody, and it's not a silver bullet for everybody. We're still hoping for, you know, new clinical trials and combination therapies, or bringing it to the adjuvant level that's going to hopefully prevent a recurrence of disease for people. You know, so I think it's time to be hopeful, and we're certainly at a point in time where a lot of change is happening. So, is there any more comments? Anybody else want to say anything up here? Add anything? I don't want to cut you off early. One more thing, Richard.
Maybe appropriate.
Better speak in the mic.
Maybe appropriate and maybe inappropriate, but I hear so many times when people say, I've been given so long or whatever, and it seems like human nature is such that we want finite answers. And I really wish they wouldn't try to give those answers, because the truth is nobody knows. And I found there's so many people that I've met with on the journey who were given answers and they almost lived down to them. And I really don't believe that's necessary. I think the best thing you can do is the reality, and even statistically, it's how that message is delivered. It should be, if this is it, the statistics tell us. But I don't think they should even do that, because we're not each a statistics, we're a part of it. And I wish they'd just completely stay away from that, because I think you can will yourself to be fairly unwell, and giving up is easy when you're down. So I wish they wouldn't do it.
Thanks, Richard. Great. Well, I'd like to thank the panel. It takes a lot to get up in front of a group and to talk about your journey. So just like to thank you all very, very much. Very compelling stories. And I think there's a lot of people out in the audience that can relate to that.